Through the Alternative Access to Kits model,
Healthcare providers can bulk order free bowel cancer screening test kits, or IFOBT kits,
and issue them to eligible patients during an appointment. Talking with a healthcare provider can be key in helping people decide to do the bowel screening test, and could help increase low screening rates in some community groups. This video will guide you through the process of bulk ordering bowel screening test kits for your practice. Kits can only be ordered in bulk via the healthcare provider portal, and not your integrated clinical software. If you haven't accessed the healthcare provider portal yet, visit ncsr.gov.au/healthcare provider portal for instructions. Once logged into the portal, select the IFOBT bulk order button, then start your order. Enter your clinic name and phone number, noting the address will pre-populate, but you can enter a different delivery address if you wish. This won't change the address held in Medicare, it will just be for this order. Kits are ordered in batches of 10, with the recommended number per provider being no more than 30 kits. More can be ordered if you have a large eligible patient base, but the kits have an expiry of about 7 months, so keep this in mind when you're calculating how many kits you need. You will also be asked how many healthcare providers the request is for, how many kits you currently have in stock, the answer here can be 0, and if you do have kits in stock, whether any are expiring within 4 weeks. Capturing this information will help minimize kit wastage. You will need to provide a reason for orders of 40 or more kits to help us better understand how large orders of kits will be used. Confirm your order, check the acknowledgement, and submit. Please allow up to 4 weeks for delivery. A tracking number will display within 10 business days. To find out more about the National Bowel Cancer Screening Program and the Alternative Access to Kits model, visit health.gov.au/NBCSP.